ambulance when I need one. Give me something for my pain. Tell the government to pay the hospital. I'll be back on my feet again.
Arriving at a major hospital, Henry Ford Medical Center, downtown, right away the triage nurse were telling the EMTs, take me to the industrial clinic. And they stayed there and argued with her for a period of time, saying, this is a very serious accident. We don't know how severe her injuries are. We've got paralysis. We've got increase in blood pressure. We know she's in shock. We have to bring her to ER.
Is the industrial clinic a part of Henry Ford?
Yes, they have their own. It's just segregated. Where ER, they have rooms that they put people in. For the industrial clinic, basically they left me in a hallway. And they told me, well, actually, they didn't move me at all from triage until the guard made the EMTs leave. Because they kept telling the nurse, this is not standard procedure for this type of injury. She has to come to emergency. And then they got another call. They said, well, we're going to have to leave. And at that point, the security guard showed up and he said, we would like you gentlemen to leave anyway. Your job is finished now. And then he came over and asked me, he said, I understand there's some problem here. Can you tell me why you're here? I said, I've had a terrible accident. I'm in a lot of pain and I cannot move. I'm here for treatment. They rolled me down a hallway and put me in line and said, don't worry, you're probably the fourth to be taken care of. I was lapsing in and out of consciousness. I was in a lot of pain, and that was at about 10, 12 in the morning that they got me to the hospital and I got put in the hallway. At 4 p.m. when I was alert and well enough to look at my watch and seen how late it was and started to really take stock of my surroundings, I heard them talking to a guy just like around the curtain for me or around the wall about an abscess too. And at that point I started yelling, hey, somebody come in here and help me. What is going on? And that's when I learned that I had been misplaced. And then they said, well, actually, we thought you left. And I said, how's a person that's paralyzed that comes in an ambulance get up and walk out? They said, well, it happens all the time because there isn't really much we can do for comp cases. And I wanted to go to another hospital, but I didn't have any choice. When they finally came across me, my son had basically been just jogging around the hospital up and down corridors yelling, Mom, Mom. 2 guards were following them, said, we told you, gentlemen, you'll have to leave. And my son said, I'm not leaving until I find my mother. And then when they found me and started talking to me, the guards approached and they said, ma'am, these gentlemen have to leave. I said, no. I said, I need them here. I said, I don't know what kind of medical facility this is, but I was rushed into ER. I've been here all day. No one's helping me. No one's taking care of me. I said, if you want to do your job, find out where the nurses and doctors are. That evening, after the security guard sent a doctor over, he said, well, what are you doing over here? I said, this is where they put me. Then they went through the same thing again, and I said, well, look, I said, besides having something for pain and something for care, I said, what are you going to do with me? Can I get some water? Can I get something to eat? They said no. And then they sent me for another test. They come back. The doctor says, well, we're going to try to get you out of bed. I said, I've been here all day. I can't move my one leg. I can't move. He said, oh, we'll help you. And then when they found out that I actually could not stand and that I could not move the one leg and the pain got very much worse, they said, okay, get in bed. Don't worry about it. And my son said, what are you going to do? And they looked at their watch. Then it was 12 a.m. in the morning. And he said, well, the industrial clinic opens up again at 8 a.m., so we guess we'll just keep her here till then. And that's when I asked again. I said, well, can I have some more intravenous fluids? Can I have something to drink? Can I have anything to eat? No, you're not actually admitted to the hospital. You're not in ER. You're not really here, they told me. Complained about this to workers' comp and to Henry Ford Hospital 3 days later. They told me, they said, "Ma'am, do you realize we don't even have to treat workers' comp patients at all? There is no state law that says we had to take you and provide any care. Workers' comp is a type of insurance. It was supposed to pay for me." And later they had no problem with sending me a bill for over $4,000.
Have you paid it?
No, and then when I told them I would not pay it, I had no intention of paying it. And when my company, was, I don't know what they were doing because they had paid the ambulance ride and everything else. The company's insurance didn't pay it. They put it through my Blue Cross. And when I got a statement from Blue Cross a couple weeks later, I called and told them, I said, "You know what?" I said, "You guys get your money back." I said, "Not only did the facility not take care of me," I said, "but this was supposed to be workers' comp. You guys aren't even responsible for this." And Blue Cross started an investigation from there.
And?
Basically, we went through the same thing with all the providers. All the providers, when they could not get money from the workers' comp insurance carrier, because I had Blue Cross Blue Shield through the company, they all billed them, which everybody seemed to think that was okay. Even the attorneys seemed to think it was okay at first. And I said, well, what is going to happen in 2 to 4 years when they start trying to reclaim that money, and then I'm going to be responsible for it? And that's exactly what happened. It was only last year that all the bills have been resolved.
Okay.
And the worst of it was, though, after 3 months, the workers' comp place also cut off my weekly disability wage. Besides the fact they wouldn't let me see doctors, wouldn't let me get the care I need and pay for it and everything. And if I had not had a good family doctor, I wouldn't have gotten any care at all. Then they cut my weekly wage. And then when you call and you try to talk to them, if you don't like it, sue us. And basically, that's their standard operating procedure. 90% of the cases that go to workers' comp, if there is any serious injury in 2 to 3 months, between 5 and 12 weeks is when they cut off your pay and they say, if you don't like what we're doing for you, go somewhere else, get a lawyer. When you get a lawyer, it takes 1 to 2 years, and the legal system does not want these cases.
Right.
They can't resolve workers' comp cases. So you have 2 choices. You either wait 2 years until the time limit's up and the court has to put you on the docket and see you, or you make an agreement with the other side. And then you learn very shortly after you've been downtown a couple times to the building and see what goes on, that when you do walk into that courtroom, because of the way the law is structured, even if they decide in your favor, all you can get is the judge can order workers' comp. Yes, you have to take care of this person's medical expenses, and you have to take care of their weekly disability wage. But they are still in control of your care. I met people who had been 5 years in the system, and because they thought they would be disabled for life and they were afraid they would not get better, they didn't want to take settlement, and yet they had to repeatedly go into court because comp was supposed to be paying for their care, but they would just make all these delays so the person couldn't get any care. I decided that I would settle my case merely so I could get control of my care, and I really thought that I would be able to get the care I needed, get healed, and return to work.
Which didn't happen.
No, unfortunately it didn't, but by getting the small settlement, I was able to at least get control of my care, so I could get some care. I got to see some specialists, but then I found out it was a situation where it was too little, too late.
Send me an ambulance when I need one. Give me something for my pain. Tell the government to pay the hospital. I'll be back on my feet again.